Hi, ladies. Welcome back to this little series that I'm currently doing around opening up the conversation on menopause. So hopefully by now you've seen the very first video where I talked about just let's talk about menopause with one another. Whether it's your partner, whether it's family, whether it's friends, just bringing that conversation up if you're struggling and asking for support. These really important people in your life need to know what's going on. And even if it means speaking potentially to your manager or supervisor, it's an opportunity to let them understand where you're at and what support you may need. So that was the first thing we talked about. Then I just recently did a video around having the conversation about menopause with your healthcare professional. I don't know if that's your doctor, a nurse, anyone else in your GP's practice. Who are you having your menopause conversation with? And if you're not, then you do need to have that conversation with somebody in the healthcare profession if you are really struggling and feeling completely overwhelmed and lost as to what you are experiencing, like how to even manage what you're experiencing. So that was the second thing. Now I want to dive into opening up the conversation about treatment options. Now I alluded to the treatment options that are available to you in the previous video around having conversations with your doctor. And there are many different ways that you can find treatment through a healthcare profession. And then there's also obviously ways that you can find treatment support through someone like myself, who is a nutritionist, a health coach, somebody who has more holistic training so that they can help you in a lifestyle way. So let's start with the traditional treatment that you would get through a prescription. And so what you have in the prescription location would be your hormone replacement therapy or menopause hormone therapy. There's multiple different ways of describing it, but typically HRT is your most familiar acronym. And hormone replacement therapy is basically putting into your body what it is no longer producing naturally. So I had mentioned before that I am in the pharmaceutical industry and I work with diabetes. And so I have talked for many years about insulin. And insulin is very similar. We are injecting into our bodies what our pancreas is no longer naturally producing, or at least not producing enough to help support our glucose management. This is what it is with hormone replacement therapy. We're either using creams or patches or injections to put in estrogen or progesterone or a variation of this combination of different types of hormones into our body to help support the imbalance that we're experiencing when we're going through perimenopause and postmenopause. Now, hormone replacement therapy is definitely a discussion that you need to have if you want to pursue this with your GP. I have opted to take the natural route because I was not able to take hormone replacement therapy. And so if you are in the UK, you are probably seeing a really hard push right now for hormone replacement therapy as an option. Alternatively, my understanding is that there is also a shortage of hormone replacement therapy in the UK. So you're in a bit of a dichotomy of really having hormone replacement therapy positioned as a premium treatment option, but the availability is not fully there for you. So what happens if you're on HRT and you no longer have access to it? What happens if you can't take HRT? What happens if HRT doesn't work for you as well as you thought it would? And what happens if you have to come off HRT? So these are some of the things we're going to dive into today because I want you to take this information and have this conversation with your doctor. I do not manage hormone replacement therapy. It's not in my scope of practice. I am not qualified. You have to be a medical profession to have the conversation and to to prescribe. So this is a conversation you absolutely have to have with somebody who is qualified to prescribe to you. So keep that in mind. I by no means am encouraging or discouraging you to do anything that we're talking about today. I am just providing you with what's available and what options you have so you can take that knowledge and go to the right professional and have that conversation and really understand what that means for you. So I see a lot of women that I follow online really supporting the use of hormone replacement therapy. And there's nothing at all wrong with any choice that you make. So you need to make what's the choice that's absolutely best for you. My passion and my commitment is to educate you so that you know what is best for you. And when you're having the conversation with somebody, you understand the words, the language, the meaning, so that you're not kind of sitting there going, I have no idea what this person is saying to me. So that's sort of my mission, is to make sure you're educated so you can take a look at what's available and you can go, that's the one for me, and get results. Like, that's the goal, right? You want to feel better. You want to manage your menopause journey so amazing that you're not struggling with everything that you're struggling with now. So that's my mission. Got to take some water. I get a little passionate. Okay. Now, as I was saying, I see a lot of women on Instagram and Facebook sort of really promoting the benefits of hormone replacement therapy, which is fine. But then I start to see comments underneath these posts saying, I can't take hormone replacement therapy, or it's not something I'm really comfortable with, or I don't know what it all means, so I don't know where to begin. And if you're one of those ladies that can't take it, if you're like me, I have a background, like a family history in, I've lost my train of thought, breast cancer. So I can't take hormone replacement therapy. And because I have breast cancer history in my family, my mother had breast cancer twice, I'm not even comfortable sort of going into that area. So if you're one of those ladies, this should be really an interesting topic for you as well. And you may not want to take it as well. So this is why you've got to look at what other options. Now, one of the challenges around HRT, as I'm sure you all know, is that there's a lot of controversy around it. And there's still a ton of questions out there from the very different evidence that is being shown. Now, I'm an evidence-based chick. I function on science. Every decision I make, all the tools I put into this community are evidence-based. If you purchase any of my programs, my mini courses, or if you've purchased my Menopause Balance Method, my 12-week master program, everything that's in those programs is completely pulled from evidence, from data, from trials, from clinical studies that prove these methods are effective. And that is extremely important. You want to go to somebody who is making decisions based on evidence. And that's why there's still so much controversy around HRT, because you've got the camp that says it's dangerous, that you're at risk of cancer. You've got the other camp that says it's required because if you don't take it, you're at risk of osteoporosis and heart disease. And then you've got the other camp that's saying you can go natural, you don't need it. No wonder we're confused, right? No wonder we're sitting here going, I don't know what to do. So we can talk about a couple of things today. So who can take it? That's who you have to talk to your doctor about. You have to speak to your doctor about whether or not you're eligible to take it and if it's the right fit for you. Why should you take it? Talk to your doctor about it as well. Why would you ask your doctor, why should I take hormone replacement therapy? What are the benefits? What are the disadvantages? So that these are the questions. So you want to ask if you can take it. You want to ask, why should I take it? You also want to ask, how long should you be on it? Again, there's a lot of different responses out there of how long you should be on it. Some say don't start before 60. Some say don't be on it longer than 5 years. So that's what you need to converse with your GP about to find out how long you should be on it. Because depending on your symptom profile, You could be very mild or you could be extreme. And regardless of where you are in that spectrum, we shouldn't be suffering. So you need to do what's best for you to alleviate that suffering as soon as possible. And so how long is that going to take? Because when you come off hormone replacement therapy, you do have that risk of those symptoms reemerging. And so you need to be aware of that, and you need to know, what does that look like? And what happens when you come off of it, right? When you decide that you do want to come off, or there's a scenario where you need to come off of it, what is that going to look like? And you also need to ask your doctor, will hormone replacement therapy manage all my symptoms? Will this give me the relief I'm looking for? Because it may or it may not. I know a lot of women that have done amazing on HRT, and I know a lot of women who have had some symptoms resolved, but others they're still struggling with. And so what does that look like? What happens if you're on HRT, you're finally starting to see some benefits, but then other problems emerge that are not being managed? How do you cope with that? So this is why you've got to choose the choice that's best for you, because this decision is so individual. It's very, very much 100% about you and about what your journey looks like and about what you want for yourself. So definitely dive deep into that conversation. And if you can't dive deep into that conversation, please don't still sit there suffering. Reach out. Let's see what we can do to get you onto a path that's going to get you some solutions. So this is why we need to really have these conversations with our healthcare professionals, because there's a huge gap, I think, that a lot of doctors, both male and female, don't know as much about menopause as we think they do, or that they should, so that they can treat each woman based on their specific needs, because one size does not fit all. And not all treatments are guaranteed results, right? So you can, like I said before, you can start HRT but not see the results that you want. So then you're going to have to go back and do dose adjustments. You're going to have some additions. And what is the formulation that you would like to use? Do you want to use cream? Do you want to use injection? What about patches? So I don't know if there are other formulations, but those are the ones that I do know of. And so what's best for you, best for your lifestyle? So the bottom line here is having the conversation and not assuming anything is really huge, because, we have to advocate for what we need, and being equipped with asking the right questions when you go into that office is going to make you feel empowered and know that you're asking the right questions to get the right answers. So that's a lot about HRT. You also have to consider about the availability. If there's an HRT shortage, what does that look like for you? Do you have options besides that, right? And that's why, whether you are on any kind of medication, hormone replacement therapy, I still feel like your natural way of managing menopause should be your foundation. You can add in these extra support units, but at the end of the day, how you eat, sleep, manage stress, manage your overall health and your activity and your mindset. How is your thyroid health? How is your adrenals? How is your inflammation, right? So all those things, I think, should always be your underlying maintenance. And if you need to pull in other support, that makes for a really effective group approach into managing your menopause symptoms, if that's right for you. Now, what's really interesting is that there are guidelines for your cardiovascular health. There are guidelines for diabetes. There are even guidelines for menopause. However, your treatment algorithm for all of these is only medication. So you've got some lifestyle options within the guidelines with diabetes, but I often wonder how many of us can have that conversation with our healthcare professional around just natural solutions, right? We usually get referred to a dietitian for any kind of dietary nutritional support. We get referred to a trainer, or say, hey, go exercise at the gym. But it's very piecemeal. Like we have to search out these different resources to help us individually, whereas it would be so nice to have something all in one to help us, right? So if you are really looking at hormone replacement therapy and you want specific questions to be asked, then comment below and I'll throw in some questions for you so that you can take those along to that conversation so you really feel confident. Another area that you may be offered, and we touched on it in the last video, were antidepressants. And as I had mentioned, that class of medications are either SSRIs or SNRIs. They're either serotonin or norepinephrine reuptake inhibitors. And so these are medications that really focus on hot flashes specifically. So they work. Basically, I guess the best to describe is they sort of rebalance or they intercept the chemicals in the brain that transmit that hot flash alarm. So that would be the epinephrine or the serotonin. So when your blood vessels dilate and release that heat, your brain goes off and says hot flash, and that's where the SSRI or the SNRI cuts that off. It intercepts that signal. So you're not getting that flush of heat, right? When your blood vessels open up. So it's not releasing the heat. And it all comes from the HB axis that's saying you're overheating, and then your blood vessels expand, and then your serotonin and epinephrine kicks in and goes, you've got a hot flash. We need to heat up to release, right? Because when you heat your body, it's a way of releasing heat. So that cuts it off, and that's why antidepressants have shown in evidence to have a reasonable effect on hot flash control. So again, it's a medication that you're putting into your body that is working on your brain chemicals, but it also comes with different side effects as well. So you may have some issues with weight, you may have some issues with gut, you may have some constipation, you can have some mood swings. So definitely, if an antidepressant is something that's being offered as an option for you, really dive deep into some of the questions about, well, how long do I need to be on this? What dose would I start with? How often, do my doses need to be titrated up if they're not managing my hot flashes? What side effects could I experience? So if you do have questions around that, definitely ask them. If you do want some questions around that, let me know and I can help you with that. So when you go to the doctor, you can ask those questions. So this is likely, in some cases, you may even get offered blood pressure medication as well to support. I'm not as familiar with blood pressure medication and the role that it plays with managing menopause symptoms, simply because the whole medication treatment algorithm is not something that I'm qualified to discuss in terms of a prognosis or a diagnosis. And so these are just options that you will likely hear as potential suggestions for what you need from a medical intervention to treat your symptoms, what you may be offered. So medication versus lifestyle, clearly two different camps. And so what does the lifestyle look like? What is going naturally through menopause? And there's a couple of reasons why you may sort of defer to go naturally through menopause. Maybe your symptoms are not really severe. Maybe you can't take hormone replacement therapy. Maybe you don't want to go onto medication because it's not something that you're really comfortable starting. Maybe you're still really unsure about what the facts are and what the evidence is. And even after you've had conversations with your doctor, maybe you still want to see if you can do this naturally by managing it on your own. So what does that look like? Well, it's really just pillars to help reduce the risk of a few things that are going on in your life when you are going through menopause. So obviously you've got a hormone imbalance. So we want to try and stabilize those fluctuating hormones. We also know that we can have some nutritional deficiencies because we don't absorb our nutrients as effectively as we used to. We also know that we can have a lot of issues emotionally around anxiety and confidence and brain fog and mood. So we really want to use put a lot of focus into that. Obviously our weight, right? We tend to gain quite a bit of weight around our middle from our stress and our cortisol. Our adrenals are affecting our gut. So there's a lot of different moving parts when you're looking at going naturally, but what it is, oh, nobody's barking, so that's good. I just got a delivery. So what it is, it's really just peeling back the onion and going layer by layer by layer. Now, I would say that probably most likely both journeys, whether you go through a medical option or you go through a natural option, they are probably going to be similar. But the natural option is definitely going to be a little, I would say it's definitely going to be longer because you're going to have to go through the layers of change. The beautiful thing about going natural, though, is that those changes will stay, if you know what I mean. You will maintain them. With the medical option, if you come off those medications, those symptoms have not been managed, right? They've just been, or haven't been alleviated. They've just been managed. So you've just put something into your body to help control the symptoms. When you go through the natural route, you're actually getting to the root cause. You're actually getting to the correction of that inflammation. You're stabilizing your hormones by focusing on your gut, focusing on your stress, focusing on your thyroid, making sure your adrenals are good. Those are all the things that are going to be rebuilt, repaired, so that as you continue to work through perimenopause and into postmenopause, you're going to see such an improvement in your symptoms, and they sustain those improvements, where you may have to adjust dosing, you may have to go higher, you may have to change the combination in the HRT, you may have to pull the estrogen, add the progesterone. So there's a lot of moving parts, right? And can you do it alone? That's the other challenge. When you're working with medication, you're working with your doctor. When you're working naturally, who are you working with? And can you keep up with all the different levels and the different layers that you have to work through on your own? Or do you need coaching? Do you need support? Do you need accountability? And so that's where someone like myself can come in, because I can be there for you on a regular basis to speak specifically to your needs. So if you're struggling in one area, we can say, hey, you know what? This is good, because let's take a look at why you're struggling and let's make the adjustments. And we're doing it all naturally. Maybe you're not eating enough. Maybe you're over exercising. Maybe there's some major stressful, acute stress situation going on in your life that you need support and coaching through. Maybe there's something going on with your sleep, and by talking through it, we can make some few minor tweaks and you can see some big differences in your sleep quality. Also, your supplement support. I am not a huge supplement advocate. I've never been one to sort of throw 16 supplements at my clients, because the consultation that I have with my clients allows me to tease out exactly what the issues are, and we start with the first one. We don't throw a bunch of things at somebody, because I don't know what's fixing it if I throw a bunch of things at somebody. So we start with the first thing, and I sort of have my standard 3 supplements that are my first to go, because 90% of women see results just by adding in those 3 supplements. And we start with the one, and we run with it, and we see how we do. And then we check in, because you would be checking in with me weekly when you work with me. And then we go to the next one, and then we go, okay, now let's work on this. And we do it in a tiered approach. So we get a maintenance and improvement here. Great. We got a really good foundation. Now let's go to the next level. Okay, now we're working here. Let's get this right where we need it. Awesome. Now let's go to the next level. So you can see that it is a much more comprehensive, much more customized, much more specialized to you approach than potentially putting you on an antidepressant or another medication. So it's very different paths. I chose the natural path. I chose to work with somebody to really deep dive to get a lot of my symptoms repaired and eliminated. And I think that's what was the catch for me, is they were completely eliminated. I didn't have to worry about coming off anything and having them resurge. So I worked with somebody and found such an incredible response that I decided to go back to school and learn to do this myself. And what I did was then just take it to the next level, because I applied all my learnings, and I've been using those learnings for the past 5 years to just continue to improve my health and my internal wellness. And all my symptoms are more than managed, and in many cases completely eliminated. So that's why it's so important to have these conversations, ladies, because you need to know what's the difference between working with a GP versus a nutritionist. I'm a health coach as well as a nutrition practitioner. You know, there's a completely different approach to how we work with our clients, to how they work with their patients. And it all depends on what you need, right? What do you want? How does this look for you? And what aligns with you better? What is your ideal of the perfect menopause journey? For me, it was to figure this nut out. It was like I was determined. I was like a dog with a bone. I knew I could do it. And I'm so excited when I see women really see benefits from doing this naturally. Only if it's best for them, right? And this is why this community is amazing. There's no judgment. There's no, this is right, this is wrong. Everything is right if it's right for you, right? Anything you choose that's right for you, then it's right. And that's what I am so passionate about, is making sure you know what's right for you so you can do what that is and get results. So there's that difference in terms of natural versus medication. And then also the world of Google, Dr. Google. We got to throw Dr. Google in there, because Dr. Google is a big player. And that is always a challenge, right? Because when you throw something into Google, like hot flash control, like I'm surprised we just don't get knocked off our chair with the amount of content that flies up on that screen. Wading through that not only is time consuming, not only is overwhelming, some of it is like way over your head, right? Because you're like, I don't even understand the language that they're describing. And some are just like, oh, just don't eat spicy food. Well, great. If it was that easy, none of us would be struggling with hot flashes, right? So going through Dr. Google would be probably the one that I would definitely take a stand and say avoid. There's really such a mixed combination of so much in there that you're just clutching at straws. You're throwing a bunch of darts at a dartboard and hoping something sticks, right? So Google versus a GP or versus a nutritionist or a coach, very, very different things. So if you want to do high level things like actually Google a supplement, say I was recommending a supplement, then Google a supplement specific, then that makes sense. So if you're talking to your doctor and they say, you know, this might be a side effect, Google that side effect and what does that look like? That makes sense. But if you just want to say, how do I manage menopause, or just throw out these broad things, you're being thrown into this ever-ending rabbit hole. So I really recommend you avoid Dr. Google at all costs on that respect. So I hope that's helpful. If you have any questions at all, or if you have any comments about your own experience, I would love to hear it. This is such a supportive community, and whether your decision is your decision, and the utmost respect for whatever it is you decide. But I wanted to make sure that you were really comfortable, and I wanted to open the conversation up about the different treatment options that are available. And if you do want more info on anything, then absolutely comment below and I will reach out to chat with you personally. Thanks, ladies. As always, I appreciate your time. Talk soon.